Mercy General Hospital, 5:47 a.m. A woman in oversized scrubs shuffled down the fluorescent-lit corridor, her footsteps barely audible against the polished linoleum floor. What the staff didn't know was that Captain Adrienne Phoenix Martinez, decorated Navy SEAL officer and recipient of 3 Purple Hearts, was about to shatter every assumption they'd made about the quiet woman they'd been tormenting for 6 months. The harsh overhead lights cast long shadows as Adrienne pushed her supply cart past the bustling nurses' station. Her dark hair was pulled back in a simple ponytail, her shoulders slightly hunched forward in a posture that screamed defeat to anyone watching. She moved with deliberate slowness, each action measured and careful, as if she were afraid of breaking something or being broken herself. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. Well, look who finally decided to show up, sneered Patricia Hawthorne, the head nurse whose voice could cut glass and whose cruelty seemed to know no bounds. Patricia stood behind the central desk like a general surveying her battlefield, her perfectly manicured nails tapping against a clipboard with military precision. Running late again, Weston? Adrienne had chosen the surname Weston when she'd applied for the job, a deliberate distance from the Martinez name that had once commanded respect in every naval base from San Diego to Norfolk. She kept her eyes downcast, focusing on the wheels of her cart as they squeaked rhythmically against the floor. "Sorry, Nurse Hawthorne," Adrienne whispered, her voice barely carrying across the bustling station. Traffic was heavy on Route 9. A chorus of muffled laughter erupted from the cluster of nurses gathered around Patricia. Among them stood Jennifer Kyle, a recent nursing school graduate whose insecurity manifested as cruelty toward anyone she perceived as weaker. Jennifer's blonde hair was pulled into an aggressive high ponytail that seemed to pull her features into a permanent expression of disdain. "Traffic!" Jennifer scoffed loud enough for everyone to hear. "Or did you get lost again? I swear sometimes I wonder how you even found your way to nursing school, let alone graduated." The truth was far more complex than any of them could imagine. Adrienne hadn't attended traditional nursing school. She'd learned trauma medicine in the blood-soaked fields of Afghanistan, where every second counted and failure meant watching good soldiers die. Her medical training had come from Navy corpsmen who could perform surgery with nothing but a flashlight and steady hands, in conditions that would send civilian doctors running for cover. Dr. Richard Pemberton emerged from the nearby break room, his coffee mug steaming in the cool morning air. He was a man in his 50s whose success had bred an arrogance that poisoned everything around him. His eyes fell on Adrienne with the same dismissive glance he might give to a piece of outdated equipment. "Ah, our resident ghost," Dr. Pemberton announced to no one in particular, his voice dripping with condescension. "Tell me, Weston, do you actually know what you're doing, or are you just here to practice folding linens until you figure it out?" Adrienne's hands tightened almost imperceptibly around the handle of her supply cart. For just a moment, muscle memory kicked in, the same grip she'd used on her M4 carbine during night raids in Kandahar. But she forced herself to relax, to maintain the facade of weakness that had become her shield against a world that no longer understood her. "I'm here to help however I can, Doctor," she replied softly, her words nearly lost in the ambient noise of monitors beeping and conversations echoing through the corridors. What none of them knew was that Adrienne's help had once included leading a classified rescue mission that saved 14 hostages from a terrorist compound, earning her a promotion to captain at an age when most officers were still learning basic leadership. They couldn't see the woman who had once coordinated surgical strikes with the precision of a master chess player, whose tactical brilliance had been legendary among special operations forces. Patricia stepped closer, her heels clicking against the floor like a countdown timer. "I've been watching you, Weston," she said, her voice taking on a dangerous edge. "Your medication distributions are slow, your patient interactions are minimal, and frankly, I'm beginning to question whether you belong here at all." The irony was devastating. Patricia was criticizing the very woman who had once managed field hospitals under enemy fire, who had coordinated medical evacuations while insurgent rounds whistled overhead. Adrienne had overseen the treatment of hundreds of wounded soldiers, making life-and-death decisions with the kind of calm competence that Patricia couldn't comprehend. "I understand your concerns," Adrienne said, her voice maintaining that same defeated tone that had become her trademark at Mercy General. "I'll try to do better." Jennifer Kyle leaned against the desk, her voice taking on the sing-song quality of someone who enjoyed inflicting psychological wounds. "You know what I think? I think nursing school was probably the hardest thing you've ever done. Some people just aren't cut out for high-pressure situations." If Jennifer had known that Adrienne had once performed emergency surgery on a fellow SEAL while hanging upside down from a rope during a helicopter extraction, she might have chosen her words more carefully. If she'd known that Adrienne had earned the nickname Phoenix because she had a supernatural ability to rise from impossible situations and bring others with her, she might have shown more respect. But Jennifer didn't know any of that. None of them did. Adrienne simply nodded and continued pushing her cart toward the medical supply closet, her head down, her movements careful and deliberate. She had become an expert at invisibility, at making herself small enough to avoid the kind of attention that might lead to questions about her past. The morning shift was beginning in earnest now, and Mercy General Hospital was coming alive with the controlled chaos that defined modern healthcare. Doctors hurried between rooms, nurses checked charts and administered medications, and the constant background hum of medical equipment created a symphony of healing and hope. But for Adrienne Martinez, Captain Martinez, each day felt like a slow death of the spirit. She had traded the adrenaline rush of combat operations for the mind-numbing routine of inventory counts and bed changes. She had exchanged the respect of elite warriors for the disdain of civilians who saw only what they expected to see. A quiet, unremarkable woman who barely seemed capable of handling basic nursing duties. What they didn't understand was that Adrienne wasn't hiding because she was weak. She was hiding because she was too strong for a world that no longer knew what to do with warriors like her. The systematic degradation of Adrienne Weston had become as routine as the morning medication rounds at Mercy General Hospital. For 6 months, the staff had perfected their campaign of professional cruelty, each small humiliation building upon the last like layers of scar tissue. "Weston!" Patricia Hawthorne's voice cracked like a whip across the pediatric ward. "Room 314 is complaining that you took 20 minutes to respond to their call button. 20 minutes! Do you understand that in a real hospital that kind of negligence could kill someone?" Adrienne stood in the doorway, her supply cart positioned defensively in front of her like a shield. The truth was that she'd been in room 318, quietly talking a terrified 8-year-old through a panic attack using the same calm, steady voice she'd once used to guide wounded soldiers through their darkest moments. The child had finally stopped crying and fallen asleep in her arms, but explaining that would only invite more ridicule. "I apologize, Nurse Hawthorne. It won't happen again." Dr. Rebecca Torres, a cardiac surgeon with a reputation for brilliance and an ego to match, emerged from room 312 with a chart in her hands. She glanced at Adrienne with the kind of clinical detachment usually reserved for examining specimens under a microscope. "Patricia, I need to speak with you about staffing concerns," Dr. Torres said, her voice deliberately loud enough for Adrienne to hear every word. "Some of my post-operative patients have mentioned feeling uncomfortable with certain nurses. They've specifically mentioned feeling like their care provider seemed uncertain, hesitant, almost fearful." Patricia's eyes lit up with malicious satisfaction. "Fearful, you say? How interesting." She turned to face Adrienne directly. "You wouldn't know anything about that, would you, Weston? Patients feeling like their nurse was afraid of her own shadow." What Dr. Torres couldn't see was the irony of calling fearful a woman who had once rappelled from a helicopter into a terrorist-controlled village to evacuate wounded civilians. What she couldn't understand was that Adrienne's careful, deliberate manner came not from uncertainty, but from the hypervigilance of someone who had learned that split-second decisions could mean the difference between life and death. Jennifer Kyle approached from the nurse's station, a medication tray balanced in her hands with the kind of theatrical competence that screamed for attention. "You know what's funny?" she announced to the small audience that had gathered. "I was talking to some of the nursing students yesterday, and they were asking about career advice. I told them that nursing school really separates the wheat from the chaff. Some people have what it takes, and others—" She let her gaze fall meaningfully on Adrienne. "Others probably should have chosen a less demanding profession." The cluster of staff members laughed with the kind of nervous energy that comes from watching someone else's public humiliation. Among them stood Marcus Thompson, a young orderly who had always struck Adrienne as decent, but lacked the backbone to stand up to the prevailing culture of cruelty. "Maybe she could transfer to housekeeping," suggested Nurse Angela Foster, a woman whose bitterness seemed to permeate everything around her. "I mean, she's already so quiet. Maybe cleaning rooms would be more her speed. Less pressure, fewer decisions to make." Dr. Pemberton paused in his chart review to add his voice to the chorus of degradation. "You know, Foster, that's not a bad idea. Some people are simply better suited for less complex responsibilities." He looked directly at Adrienne. "There's no shame in recognizing your limitations, Weston. Self-awareness is actually quite admirable." The casual cruelty of it all was breathtaking. Here was a man dispensing condescending advice to a woman who had once commanded a team of Navy SEALs through missions that would have given him nightmares for months. Dr. Pemberton was suggesting career changes to someone who had been personally commended by 3 different admirals for her tactical brilliance and leadership under fire. "Perhaps," Adrienne replied softly, her standard response to virtually every attack. She had learned that resistance only encouraged them, while submission usually meant the torment would end more quickly. Patricia stepped closer, sensing weakness like a predator smelling blood. "I've been thinking, Weston, maybe it's time for a formal performance review. I've been documenting some concerning patterns in your work." She held up a folder thick with papers. "Slow response times, minimal patient interaction, general reluctance to take initiative. It paints quite a picture." The folder represented 6 months of manufactured complaints and twisted documentation. Every moment of careful consideration had been recorded as hesitation. Every instance of quiet competence had been reframed as timidity. Every patient who had specifically requested Adrienne's calming presence had their praise mysteriously omitted from the record. Dr. Torres nodded approvingly. "Performance accountability is crucial in healthcare. We can't afford to carry dead weight, especially in critical care areas." She glanced at her watch. "Speaking of which, I need someone to assist with a complex cardiac monitoring setup in the ICU. Someone with confidence and experience." Her eyes swept past Adrienne as if she were invisible. "Jennifer, would you mind handling that? I need someone who won't freeze up if the situation becomes complicated." Jennifer practically glowed with pride. "Of course, Dr. Torres. I've been hoping for more challenging assignments." As she walked past Adrienne toward the ICU, she whispered just loud enough for others to hear, "Finally, a chance to show what real nursing looks like." The irony was devastating. Jennifer was being praised for accepting a routine monitoring assignment, while standing 3 feet away was a woman who had once performed emergency heart surgery on a helicopter gunner using nothing but field medical supplies and a tactical flashlight, all while the aircraft was under enemy fire. Marcus Thompson, the young orderly, seemed to struggle with his conscience for a moment. He opened his mouth as if to say something, then caught Patricia's warning glare and thought better of it. Instead, he busied himself with organizing supply carts, his discomfort evident in the way he avoided eye contact. "Weston," Patricia continued, her voice taking on the tone of a disappointed teacher, "I want you to spend the rest of your shift doing inventory in the supply closet. Obviously, patient care isn't your strong suit, so let's find something more appropriate for your skill level." Supply closet duty was the hospital equivalent of exile, a punishment reserved for staff members who had fallen from grace. It meant spending 8 hours counting bandages and organizing medical supplies while the real work of healing happened elsewhere. Adrienne nodded obediently. "Yes, Nurse Hawthorne." As she pushed her cart toward the supply closet, she could hear the conversation continuing behind her, her colleagues discussing her failures with the casual brutality of people who had never faced real adversity. "Honestly," Dr. Pemberton was saying, "I'm not sure how she made it through nursing school. Some of these programs really need to raise their standards." "Maybe she cheated," Angela Foster suggested with a laugh, "or had someone else do her clinical rotations." The truth was that Adrienne hadn't attended traditional nursing school at all. Her medical training had come from the Navy's most elite combat medic program, where she'd learned to save lives under conditions that would have broken most of these people within minutes. She'd earned her nursing credentials through accelerated military-to-civilian transition programs designed for combat veterans whose field experience far exceeded anything taught in traditional schools. But explaining that would require revealing who she really was. And Adrienne Martinez, Captain Phoenix Martinez, had sworn to herself that she would never again be the person who had commanded respect through fear and authority. She had seen too much death, made too many impossible decisions, carried too much weight on her shoulders. The supply closet door closed behind her with a soft click, and for the first time that morning, Adrienne allowed herself a moment of quiet reflection. Surrounded by neat rows of medical supplies, she could almost pretend that this was just another mission, another challenge to be endured with grace and dignity. But as she began counting boxes of surgical gloves, she couldn't shake the feeling that something was coming. Something that would shatter the careful facade she'd built around herself and force her back into a world she'd tried so desperately to leave behind. The subtle contradictions in Adrienne Weston's behavior began to surface in ways that defied easy explanation, creating ripples of confusion among the staff at Mercy General Hospital. While they saw only what they expected to see, a timid, incompetent nurse, small incidents accumulated like puzzle pieces that didn't quite fit the picture they'd constructed. It started with seemingly insignificant moments that most people dismissed or rationalized away. Dr. Sarah Chen, a young emergency resident fresh out of medical school, was the first to notice something unusual during a particularly chaotic night shift in early March. "Code trauma, incoming helicopter, ETA 3 minutes. The overhead announcement crackled through the emergency department. The usual controlled panic ensued as staff scrambled to prepare for what the dispatch had described as multiple casualties from a construction accident. Dr. Chen was frantically trying to organize the trauma bay when she realized they were short-staffed. Most of the experienced nurses were already handling other emergencies, leaving her with a skeleton crew of newer personnel. In her desperation, she grabbed the first person she saw. "Weston, I need you in Trauma Bay too. We've got multiple casualties coming in, and I need all hands." Adrienne hesitated for a moment, that familiar flicker of internal conflict crossing her features. "Dr. Chen, I'm not typically assigned to trauma." "I don't care what you're typically assigned to. I need bodies with medical training, and you're here." What happened next defied everything Dr. Chen thought she knew about the quiet, uncertain nurse. As the helicopter landed and the first casualty was wheeled in, a construction worker with severe crush injuries and possible internal bleeding, Adrienne's entire demeanor shifted in a way so subtle that most people missed it. Her movements became fluid, purposeful, economical. She positioned herself at the trauma bay with an instinctive understanding of spatial dynamics that spoke to years of experience in high-pressure medical situations. When Dr. Chen called for equipment, Adrienne had already anticipated the need and placed the instruments within easy reach. "BP dropping. We need to get him to OR stat," Dr. Chen announced, sweat beading on her forehead as she struggled to stabilize the patient. Adrienne's hands moved independently of any conscious direction, checking IV lines with practiced efficiency, monitoring vital signs with an intuitive understanding that came from somewhere deeper than textbook knowledge. At one point she caught Dr. Chen's eye and made a subtle gesture toward the patient's left side. "Doctor, you might want to check for internal bleeding in the spleen region. The impact pattern and vital signs suggest possible rupture." Dr. Chen paused, surprised by the specificity of the observation. She ordered an ultrasound, which immediately revealed exactly what Adrienne had suspected. The injured worker was rushed to surgery, where doctors confirmed a grade 4 splenic laceration that would have been fatal if not caught immediately. "How did you know to look there?" Dr. Chen asked later, but Adrienne had already retreated into her familiar shell of apologetic uncertainty. Sometimes you notice patterns," she mumbled, avoiding eye contact. "I probably overstepped. I should stick to my assigned duties." But Dr. Chen couldn't shake the memory of those moments when Weston had moved with the confidence and expertise of someone with far more experience than her personnel file suggested. The incidents multiplied, each one adding another layer of confusion to the growing mystery. During a pediatric emergency involving a child who had fallen from playground equipment, Adrienne instinctively knew exactly how to position the young patient to prevent spinal injury during transport. Her movements were so smooth, so automatic, that it looked like choreography. When Nurse Foster commented on it later, Adrienne simply shrugged. "I read about proper positioning techniques in a medical journal," she offered weakly. But medical journals didn't teach the kind of muscle memory that Adrienne displayed, the unconscious competence that only came from doing something hundreds of times under real-world pressure. Marcus Thompson, the young orderly, began to notice other peculiarities. Sometimes when he was moving equipment late at night, he would catch glimpses of Adrienne in supply closets or empty hallways, her posture completely different when she thought no one was watching. Gone was the hunched, defensive stance she maintained around other staff. Instead, she stood straight, alert, scanning her environment with the systematic thoroughness of someone trained in situational awareness. Once he accidentally startled her while she was counting inventory, approaching too quietly from behind. Her reaction was lightning fast and completely out of proportion to the situation. She spun around in a defensive crouch, her hands moving to positions that suggested combat training before immediately catching herself and resuming her typical apologetic demeanor. "Sorry, Marcus," she said quickly, her voice shaking slightly. "You startled me. I've always been jumpy." But Marcus had seen that kind of reaction before. His older brother was a Marine veteran who exhibited similar hypervigilance and defensive instincts. The way Weston had moved wasn't the response of someone who was simply jumpy. It was the automatic reaction of someone who had been trained to respond to potential threats. Dr. Pemberton, despite his general dismissal of Adrienne's capabilities, couldn't help but notice her uncanny ability to anticipate medical needs during emergencies. She seemed to have an intuitive understanding of emergency protocols that went beyond anything taught in basic nursing programs. During a cardiac arrest in the geriatric ward, she had positioned the defibrillator and prepared medications before they were even requested. "Lucky guess," he muttered to himself, unwilling to reconsider his assessment of her competence. The most significant incident occurred during a night shift in late March. A gang-related shooting had brought multiple victims to the emergency department, creating chaos that pushed the staff beyond their normal capacity. Adrienne was assigned to assist with the least critical patients, but when one of the gunshot victims began to crash unexpectedly, she found herself in the middle of a life-or-death situation. The patient, a young man with what had initially appeared to be a non-life-threatening shoulder wound, suddenly went into shock. His blood pressure plummeted and his breathing became labored. "He's bleeding internally," Adrienne said quietly to Dr. Chen, who was struggling to identify the source of the deterioration. "How can you tell? The entry wound is superficial." Adrienne hesitated, clearly torn between revealing knowledge she shouldn't possess and watching a patient die. The bullet trajectory, if it deflected off the clavicle, it could have nicked the subclavian artery. The delayed bleeding would explain the sudden onset of shock. Dr. Chen stared at her. That's exactly what happened. How did you know that?" Again, Adrienne retreated into uncertainty. I read about ballistic trauma patterns. I'm probably wrong." But she wasn't wrong. The subsequent surgery revealed precisely the injury she had described, and the young man's life was saved because of her quick assessment. These incidents created a growing sense of cognitive dissonance among the staff who had dismissed Adrienne as incompetent. The woman they saw as timid and uncertain kept demonstrating knowledge and instincts that contradicted everything they thought they knew about her. Patricia Hawthorne, increasingly frustrated by these anomalies, began to watch Adrienne more closely. She couldn't reconcile the nurse who cowered during daily confrontations with the same woman who seemed to possess almost supernatural medical intuition during emergencies. "There's something off about Weston," she confided to Dr. Torres during a break. "Sometimes it's like she's two different people." Dr. Torres nodded thoughtfully. "I've noticed it too. During routine tasks, she seems lost, uncertain, but in crisis situations—" She paused, trying to articulate something she couldn't quite define. "It's like she transforms into someone else entirely." Jennifer Kyle, whose jealousy had initially been based on simple workplace dynamics, began to feel increasingly uneasy about Adrienne's hidden competence. The quiet nurse she had dismissed as weak kept demonstrating skills that made Jennifer's own training look elementary by comparison. "Maybe she's been lying about her experience," Jennifer suggested to Angela Foster. "Maybe she worked somewhere else before coming here, somewhere that gave her more advanced training." But Adrienne's employment record showed only basic nursing credentials and no previous hospital experience. Her references were solid but unremarkable, and her background check had revealed nothing unusual. The truth was that Adrienne's personnel file was carefully constructed fiction, designed to hide a military career that had taken her places and shown her things that most civilian medical professionals would never encounter. Her medical knowledge came not from textbooks, but from battlefield conditions where theoretical knowledge became practical reality in seconds. As spring arrived at Mercy General Hospital, The mystery of Adrienne Weston deepened. Staff members began to whisper among themselves, sharing stories of her inexplicable competence during emergencies and her equally inexplicable retreat into uncertainty afterward. Something was building toward a revelation that none of them could anticipate, a moment when the carefully constructed facade would crumble and reveal the truth about the quiet woman they had underestimated for so long. The stage was being set for an event that would force Adrienne Martinez to choose between the safety of her anonymity and the demands of her true nature. The morning of April 15th began like any other at Mercy General Hospital, with the familiar rhythm of shift changes and routine procedures creating a false sense of normalcy. The early spring air carried the promise of renewal, but inside the sterile corridors no one could have predicted that this day would shatter the careful equilibrium that had defined life at the hospital for months. At 10:47 a.m., everything changed. The first indication of catastrophe came through the hospital's emergency communication system, a harsh electronic wail that cut through the ambient noise like a scream. The overhead speakers crackled to life with an urgency that sent chills down every spine in the building. Attention all medical personnel, mass casualty event inbound, multiple trauma victims from industrial explosion at North Shore Chemical Plant. ETA 15 minutes. All available staff report to emergency stations immediately. This is not a drill. The announcement triggered immediate chaos throughout Mercy General. Nurses abandoned their routine tasks, doctors dropped their charts, and support staff scrambled to prepare for an influx of critically injured patients that would test every system the hospital had in place. Dr. Rebecca Torres, who had been reviewing surgical schedules in her office, burst through the doors of the emergency department with the kind of controlled panic that spoke to years of experience in crisis management. "How many casualties are we talking about?" she demanded of the chief resident. "Initial reports suggest at least 20 victims, possibly more," Dr. Martinez replied, his face pale with the magnitude of the situation. "Chemical burns, blast injuries, possible toxic inhalation. We're looking at every type of trauma you can imagine." Patricia Hawthorne appeared at the nurse's station, her usual composure cracking under the pressure of coordinating resources for a disaster that exceeded anything they had prepared for. "We don't have enough trauma bays," she announced, her voice carrying a note of desperation. "We're going to have to convert the entire East Wing into a temporary treatment area." The hospital's emergency protocols designed for routine accidents and isolated incidents were wholly inadequate for the scale of devastation heading their way. As staff members rushed to implement disaster procedures that most of them had only read about in training manuals, the true scope of their unpreparedness became apparent. Dr. Chen, still traumatized by her recent experiences with mass casualty simulations during residency, found herself assigned to coordinate triage, the brutal process of deciding who would receive immediate treatment and who would have to wait. It was a responsibility that required experience and judgment she wasn't sure she possessed. "I need experienced trauma nurses for triage support," she announced to the assembled staff. "People who can make quick decisions under pressure and won't freeze when things get complicated." Patricia's eyes swept across the available personnel, mentally cataloging capabilities and experience levels. Jennifer Kyle stepped forward immediately, her eagerness to prove herself overriding any realistic assessment of her abilities. "I can handle triage, Dr. Chen," Jennifer announced with the kind of confidence that comes from never having faced real adversity. "I've been training for situations exactly like this." But as the first ambulances began to arrive, their sirens wailing like harbingers of doom, it became clear that no amount of training could have prepared the staff for what they were about to face. The first victim wheeled through the doors was a maintenance worker whose clothes had been shredded by the explosion, his body covered in chemical burns that made seasoned professionals gasp in horror. The acrid smell of industrial chemicals clung to his skin, creating a toxic cloud that sent several staff members reeling. "He's in respiratory distress," the paramedic shouted over the chaos. "Possible chemical inhalation, severe burns over 60% of his body. We couldn't establish an IV en route. His veins are too damaged." Dr. Chen stared at the victim, her textbook knowledge suddenly seeming woefully inadequate in the face of such devastating injury. The burns were unlike anything she had encountered in her limited experience, the chemical damage creating patterns of tissue destruction that didn't match the neat diagrams she had studied in medical school. Jennifer Kyle, who had positioned herself at the triage station with such confidence just minutes earlier, found herself frozen as more victims arrived in rapid succession. Each case presented complexities that exceeded her training, injuries that required split-second decisions based on experience she simply didn't possess. I don't know how to categorize this," she whispered to Dr. Chen, indicating a victim with blast injuries that had created internal damage, invisible to surface examination. "The protocols don't cover chemical exposure combined with traumatic injury. The hospital's emergency systems, designed for isolated incidents involving one or two critical patients, began to collapse under the weight of simultaneous multiple traumas. Communication broke down as staff members found themselves overwhelmed by the sheer volume and complexity of injuries they were facing. Dr. Pemberton, summoned from his comfortable routine of non-emergency procedures, found himself confronting the kind of medical chaos that revealed the limitations of his academic knowledge. "These injuries are beyond our normal scope," he admitted to Dr. Torres, his usual arrogance replaced by frank admission of inadequacy. "We're going to need to transfer the most critical cases to specialized trauma centers." But the other trauma centers in the region were already at capacity, their own resources stretched thin by the ripple effects of the industrial disaster. Mercy General Hospital was going to have to handle the crisis with their existing staff and equipment, regardless of their preparedness level. As more ambulances arrived, each bringing victims with increasingly complex injuries, the hospital's emergency response began to fragment. Nurses who had seemed competent during routine shifts found themselves paralyzed by decision-making demands that exceeded their experience. Doctors accustomed to controlled, predictable procedures struggled with the kind of battlefield medicine that required intuitive assessment and immediate action. "We're losing control," Patricia Hawthorne announced to anyone within earshot, her voice carrying the edge of panic that she had always managed to suppress during smaller emergencies. "We don't have the personnel or the protocols for this scale of disaster." The chemical plant explosion had created a perfect storm of medical challenges that pushed Mercy General Hospital beyond its operational limits. Toxic exposure cases required specialized knowledge of chemical interactions and decontamination procedures that weren't part of standard nursing training. Blast injuries created internal damage patterns that demanded the kind of trauma experience typically found only in military or specialized emergency facilities. As the situation deteriorated, staff members began to look around desperately for additional help, for anyone with experience that might exceed the standard civilian medical training that was proving so inadequate in the face of industrial disaster. It was in this moment of desperate need that eyes began to turn toward the quiet corners, where support staff continued their routine duties, searching for any additional resources that might be pressed into emergency service. Among the supply closets and service corridors, Adrienne Weston continued her assigned inventory tasks, the sounds of chaos echoing through the hospital corridors like distant thunder. She had heard the emergency announcements, had seen the frantic preparations, but had received no orders to join the emergency response. Part of her was relieved to remain in the background, to avoid the kind of high-pressure medical decision-making that might force her to reveal capabilities she had worked so hard to hide. But as the screams of injured victims began to penetrate even the most remote areas of the hospital, she found herself struggling with the fundamental conflict between her desire for anonymity and her training as a combat medic who had sworn to preserve life at any cost. The industrial disaster at North Shore Chemical Plant was creating exactly the kind of crisis that would test every assumption the hospital staff had made about competence, experience, and the hidden depths of human capability under extreme pressure. In the coming minutes, Mercy General Hospital would discover that sometimes the person you most need in a crisis is the one you least expect to provide salvation. The breaking point came at 11:23 a.m. when a chemical plant supervisor was wheeled into Trauma Bay 3, his condition deteriorating so rapidly that even the most experienced staff members found themselves paralyzed by the complexity of his injuries. The man had been caught in the epicenter of the explosion, suffering from a lethal combination of severe chemical burns, blast trauma, and what appeared to be acute respiratory failure from toxic gas inhalation. Dr. Chen stood over the victim, her hands trembling as she tried to process the cascade of life-threatening conditions presenting. Simultaneously, the patient's airways were swelling shut from chemical exposure, his blood pressure was crashing from internal bleeding, and the burns covering 40% of his body were releasing toxins into his bloodstream faster than his kidneys could process them. "I need intubation equipment stat," Dr. Chen called out, but as she attempted to establish an airway, the chemical damage to the patient's throat made standard procedures impossible. The tissue was so swollen and damaged that conventional intubation techniques simply wouldn't work. Jennifer Kyle, who had positioned herself as the primary trauma nurse, stared at the monitors in growing panic as the patient's vital signs continued their relentless decline. "His oxygen saturation is dropping below 70%, she announced, her voice cracking with the strain of watching someone die while feeling completely helpless to intervene. Dr. Pemberton rushed into the trauma bay, summoned by the code blue announcement, but his surgical expertise proved useless in the face of injuries that defied textbook solutions. "This is beyond our capabilities, he muttered, stepping back from the bed as if the patient's condition might be contagious. "We need to transfer him immediately." "There's nowhere to transfer him," Patricia Hawthorne replied grimly. "Every trauma center within 50 miles is at capacity. We're on our own." The patient's heart rate began to spike erratically as his body went into shock from the combination of chemical poisoning and blood loss. The monitors filled the room with the urgent electronic screaming that accompanied imminent cardiac arrest, a sound that sent waves of panic through the assembled medical team. "Someone do something," Dr. Torres shouted as she entered the chaos. But even her surgical expertise seemed inadequate in the face of injuries that required knowledge and experience none of them possessed. It was at this moment of absolute crisis, as trained medical professionals stood helplessly around a dying man, that Adrienne Weston appeared in the doorway of Trauma Bay 3. She had been summoned by a desperate orderly who had been instructed to find any available personnel with medical training, but no one had expected the quiet, supposedly incompetent nurse to respond to the emergency. For a split second, Adrienne hesitated at the threshold, her internal conflict visible in the tension that crossed her features. She could see immediately what the others could not, that the patient was suffering from severe organophosphate poisoning combined with thermal and chemical burns, a combination she had encountered multiple times during her deployments in industrial areas of Afghanistan, where chemical weapons had contaminated civilian populations. The choice between maintaining her anonymity and saving a life lasted exactly 3 seconds. Without asking permission or waiting for orders, Adrienne moved into the trauma bay with the fluid, purposeful motion that had once characterized her movement through combat zones. Her transformation was so immediate and complete that several staff members actually stepped back, uncertain of what they were witnessing. "Stop the intubation," she commanded, her voice cutting through the chaos with an authority that no one in the room had ever heard from her before. The quiet, apologetic tone that had defined her interactions for months was completely gone, replaced by the kind of battlefield command presence that demanded immediate obedience. Dr. Chen looked up from her failed intubation attempt, confusion and desperation warring in her expression. "Weston, we need to establish an airway. He's going to die if we can't get him oxygen." "Standard intubation won't work with this level of chemical damage," Adrienne replied, already moving to examine the patient, with hands that moved with surgical precision. "The organophosphate exposure has caused muscular paralysis and respiratory failure. We need emergency cricothyroidotomy and immediate atropine administration." The specificity of her assessment sent shockwaves through the assembled medical team. Jennifer Kyle stared in disbelief as the woman she had dismissed as incompetent began issuing orders with the confidence of someone who had clearly dealt with similar cases before. "Cricothyroidotomy," Dr. Pemberton stammered. "That's an extremely advanced procedure. You can't possibly—" "Get me a scalpel, size 15 blade, and the smallest tracheostomy tube you have," Adrienne interrupted, her hands already palpating the patient's neck to locate the precise anatomical landmarks. "I also need atropine 2 milligrams IV push and activated charcoal for gastric lavage if he's conscious enough to swallow." Her movements were so confident, so practiced, that Dr. Torres found herself automatically reaching for the requested instruments despite her complete bewilderment at what she was witnessing. "How do you know about organophosphate poisoning?" she asked, even as she handed Adrienne the surgical blade. Adrienne didn't answer. Her entire focus was concentrated on the dying man in front of her, her hands moving with the kind of practiced efficiency that spoke to countless hours of performing similar procedures under extreme pressure. She located the cricothyroid membrane with fingertip precision, made a swift, clean incision, and inserted the breathing tube with movements so smooth they looked like choreography. The patient's oxygen saturation immediately began to improve as air flowed directly into his lungs, bypassing the damaged tissues of his upper respiratory tract. The monitors showed an instant improvement in his vital signs, the first positive change anyone had seen since he'd arrived. "Jesus Christ," Dr. Chen whispered, staring at the perfect surgical incision that had taken Adrienne less than 90 seconds to complete. "Where did you learn to do that?" But Adrienne was already moving to address the patient's other critical conditions. She administered the atropine with the kind of dosing precision that suggested intimate familiarity with chemical poisoning protocols, then began a systematic assessment of the burn patterns to determine the extent of tissue damage and the risk of infection. "The burns show classic patterns of industrial chemical exposure," she explained as she worked, her voice maintaining that same calm, authoritative tone that seemed to come from a completely different person than the timid nurse they all knew. "We need to initiate immediate fluid replacement therapy and monitor for systemic toxicity. The chemical absorption through damaged skin can cause delayed organ failure even if we stabilize his immediate conditions." Patricia Hawthorne stood frozen in the corner of the trauma bay, watching the woman she had tormented for months demonstrate medical expertise that exceeded anything she had ever witnessed. The transformation was so complete, so shocking that she couldn't process what she was seeing. "I don't understand," she whispered to Dr. Torres. "How does she know all this? Where did this come from? Dr. Torres had no answer. She was watching Adrienne work with growing amazement as the quiet nurse continued to demonstrate knowledge and skills that suggested training far beyond anything indicated in her personnel file. Within 15 minutes, Adrienne had stabilized conditions that had seemed hopeless just moments before. The patient's breathing was secure, his blood pressure had stabilized, and the immediate threat of chemical poisoning had been addressed through rapid intervention techniques that none of the other medical staff had even known existed. "He's going to make it," she announced quietly, stepping back from the bed with the same calm demeanor she had maintained throughout the entire procedure. "But he'll need continuous monitoring for the next 24 hours. Chemical poisoning can have delayed effects that won't show up immediately." The silence in Trauma Bay 3 was deafening. Every person in the room was staring at Adrienne with expressions that ranged from shock to complete bewilderment. The woman who had spent months being dismissed as incompetent had just performed emergency surgery and toxicology intervention with the skill of someone with advanced specialized training. Jennifer Kyle was the first to find her voice, though it came out as barely more than a whisper. How did you know how to do that?" For just a moment, Adrienne's carefully constructed facade flickered, and something dangerous and competent flashed behind her eyes before she caught herself and began to retreat back into the familiar shell of uncertainty. I must have read about it somewhere," she mumbled, already moving toward the door. "I should get back to my assigned duties." But as she attempted to leave the trauma bay, Dr. Torres stepped in front of her, blocking her path with the kind of determined expression that suggested she wouldn't be satisfied with evasive answers. "No," Dr. Torres said firmly. "You're not going anywhere until you explain how a supposed entry-level nurse just performed procedures that most emergency physicians couldn't execute under pressure." The confrontation in Trauma Bay 3 created a moment of suspended tension that felt like the calm before a devastating storm. Dr. Torres stood blocking the doorway, her surgical mask pulled down to reveal an expression of determined confusion, while behind her, the other staff members formed an unconscious semicircle around Adrienne, their faces reflecting varying degrees of shock and suspicion. Adrienne's shoulders hunched forward in the familiar defensive posture that had become her trademark at Mercy General. But something was different now. The competent, authoritative woman who had just saved a man's life was fighting to retreat behind the mask of incompetence she had worn for so long, and the battle was visible in every line of her body. "Dr. Torres, please," Adrienne whispered, her voice returning to that soft, apologetic tone that everyone recognized. "I really should return to my inventory duties. Nurse Hawthorne was very specific about my responsibilities today." But even as she spoke the words, her eyes involuntarily flicked back toward the patient she had just stabilized, checking his monitor readings with the kind of professional concern that contradicted her attempts at disengagement. It was a subtle gesture, but Dr. Chen caught it, and the observation added another piece to the growing puzzle of Adrienne Weston's true identity. Patricia Hawthorne, still reeling from what she had witnessed, struggled to reconcile the woman she had systematically humiliated with the medical professional who had just demonstrated expertise that exceeded her own. "Weston," she began, her voice lacking its usual commanding edge, that was extraordinary work. Where exactly did you receive training in emergency surgery and toxicology?" The question hung in the air like an accusation. Adrienne's personnel file contained only basic nursing credentials, community college training, and no indication of the advanced medical knowledge she had just displayed. The discrepancy was so glaring that it demanded explanation, but Adrienne seemed determined to retreat into the familiar safety of her assumed incompetence. "I've always been interested in emergency medicine," she replied, wrapping her arms around herself in a gesture of self-protection. I read medical journals in my spare time. Sometimes you pick up information from reading. Dr. Pemberton, who had regained some of his composure after witnessing the successful intervention, stepped forward with the skeptical expression he typically reserved for medical students who claim to have diagnosed rare conditions. Medical journals don't teach surgical technique, Weston. What you just performed was an emergency cricothyroidotomy executed with the precision of someone who has done it dozens of times under real-world conditions. The specificity of his observation caused Adrienne to flinch almost imperceptibly. The truth was that she had performed emergency airway procedures more than 50 times during her deployment, often under combat conditions that made the current hospital setting seem calm by comparison. But acknowledging that would require explanations she wasn't prepared to give. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Maybe I just got lucky, she offered weakly, taking a step toward the door that Dr. Torres continued to block. Sometimes instinct takes over in emergency situations. Jennifer Kyle, still processing her own inadequacy during the crisis, found herself studying Adrienne with new eyes. The transformation she had witnessed was too complete, too professional to be explained by luck or instinct. That wasn't instinct, she said slowly, her voice carrying a note of growing realization. That was training, advanced, specialized training. The accusation created a ripple of tension through the assembled staff. Marcus Thompson, who had been quietly observing from the corner of the room, remembered the defensive reaction he had witnessed weeks earlier when he had accidentally startled Adrienne in the supply closet. The pieces were beginning to form a picture that none of them had expected. Dr. Torres crossed her arms, her expression softening from confrontation to professional curiosity. Adrienne, I'm not trying to interrogate you, but what we just witnessed was extraordinary medical intervention under pressure. If you have training that exceeds what's in your personnel file, the hospital needs to know. We could use someone with your expertise. The offer of recognition and advancement represented everything Adrienne had once wanted: professional respect, acknowledgement of her capabilities, and opportunity to use her skills to help people. But it also represented the exposure she had spent months trying to avoid, the revelation of a past that carried weight she wasn't prepared to bear. I appreciate the recognition, Dr. Torres, Adrienne replied, her voice growing smaller with each word. But I think there's been a misunderstanding. I'm not qualified for advanced medical procedures. What happened in there was just an accident, beginner's luck. The deflection was so transparent, so obviously false, that it created an uncomfortable silence throughout the trauma bay. Everyone present had witnessed her systematic assessment of the patient's condition, her precise surgical technique, her comprehensive understanding of chemical poisoning protocols. No amount of self-deprecation could erase what they had seen. Dr. Chen, who had been quietly reviewing the patient's stabilized condition, looked up from her charts with an expression of professional bewilderment. Adrienne, your assessment of organophosphate poisoning was completely accurate. Your treatment protocol probably saved this man's life. That's not luck, that's expertise. But even as the compliments accumulated around her, Adrienne seemed to shrink further into herself, as if recognition were a form of punishment rather than reward. She had spent so much energy learning to be invisible, to be overlooked and dismissed, that praise felt like a spotlight she couldn't escape. Please, she whispered, her voice carrying a note of genuine distress that stopped the questions cold. I just want to go back to my regular duties. I don't want any special attention or recognition. I just want to be left alone. The plea revealed something deeper than simple shyness or humility. There was pain in her voice, a kind of exhausted desperation that suggested she was carrying burdens none of them could understand. Patricia Hawthorne, despite months of antagonism toward Adrienne, found herself experiencing an unexpected moment of sympathy. "Of course," Patricia said quietly, stepping aside to clear a path to the door. "But, Adrienne, if you ever want to talk about additional responsibilities or training opportunities, my door is open." The offer represented a complete reversal from months of systematic harassment, but Adrienne seemed unable to process the change in attitude. She nodded quickly and moved toward the exit, her posture radiating the kind of relief that comes from escaping an interrogation. As she reached the doorway, Dr. Torres called after her one more time. "Adrienne, whatever training you've had, wherever you learned those skills, you should be proud of what you accomplished today. You saved a life when the rest of us couldn't." Adrienne paused in the doorway without turning around, her shoulders rigid with tension. "Sometimes saving lives isn't enough," she said quietly, the words carrying a weight of meaning that none of them could decipher. Then she disappeared into the corridor, leaving behind a room full of medical professionals struggling to understand what they had just witnessed. The patient she had saved continued to breathe steadily through the airway she had created, his vital signs stable, his prognosis dramatically improved by her intervention. The monitors beeped with the rhythm of a life preserved, but the woman who had preserved it had vanished back into the shadows of the hospital, carrying secrets that grew heavier with each attempt to hide them. In the aftermath of her retreat, the staff of Trauma Bay 3 found themselves grappling with questions that had no easy answers. Who was Adrienne Weston really? What kind of training had she received? And why was she so determined to hide it? Most importantly, what trauma or tragedy had driven someone with such extraordinary capabilities to seek anonymity in a place where excellence should have been celebrated? The industrial accident had revealed more than just hidden medical expertise. It had exposed the existence of depths and mysteries that would not remain buried much longer. Forces were already in motion that would make Adrienne's continued anonymity impossible, and the quiet nurse who had saved a life while trying to remain invisible was about to discover that some secrets are too powerful to stay hidden forever. The calm she had sought was about to be shattered by revelations that would change everything she thought she understood about her ability to escape her past. The relative calm that followed Adrienne's retreat from Trauma Bay 3 lasted exactly 47 minutes. At 12:10 p.m., as the hospital staff continued to process the morning's revelations and manage the ongoing casualties from the chemical plant explosion, the distinctive sound of military rotors began to echo across the city skyline, growing steadily louder until it became impossible to ignore. The first indication that something extraordinary was approaching came from the hospital's security office, where guard Captain James Walsh was monitoring radio communications with the air traffic control tower at the nearby municipal airport. His face went pale as he listened to the incoming transmission, and he immediately reached for the hospital's internal emergency line. "This is security to hospital administration," his voice crackled over the intercom system. "We have an incoming military aircraft requesting immediate emergency landing clearance on our helipad. They're identifying themselves as a U.S. Navy Special Operations Transport, and they're specifically requesting medical personnel by name." Dr. Torres, who had been reviewing patient files in her office while trying to process the morning's events, froze at the announcement. Military aircraft didn't typically make unscheduled landings at civilian hospitals unless the situation involved matters of national security or personnel of extraordinary importance. "Did they specify which medical personnel they're requesting?" she asked through the intercom, though part of her already suspected the answer. Affirmative, doctor. They're asking specifically for someone named Captain Martinez. They keep repeating that name and saying it's a matter of urgent operational necessity. The name hit the hospital corridors like a shockwave. Captain Martinez, not Adrienne Weston, not the quiet nurse who had spent months being dismissed and humiliated. Captain Martinez, a military title that suggested rank, authority, and a level of importance that no one at Mercy General had ever suspected. Patricia Hawthorne, who had been conducting post-crisis inventory in the supply closet, where Adrienne typically worked, dropped her clipboard as the implications of the announcement sank in. "Martinez," she whispered to herself, remembering the woman who had just demonstrated impossible medical expertise under pressure. Oh my God! The sound of the approaching helicopter grew thunderous, its rotors creating a rhythmic pounding that seemed to synchronize with the collective heartbeat of everyone in the hospital. Through the windows facing the helipad, staff members could see the massive silhouette of a Navy MH-60S Seahawk approaching, its dark gray hull bristling with communications equipment and bearing the distinctive markings of Naval Special Warfare Command. Dr. Pemberton abandoned his patient rounds and joined the growing crowd of personnel gathering near the windows that offered a view of the helipad. "This is unprecedented," he muttered, his usual arrogance replaced by genuine bewilderment. "Military aircraft don't land at civilian hospitals unless there's a crisis of extraordinary magnitude." The helicopter touched down with military precision, its rotors continuing to spin as the side doors slid open with mechanical efficiency. What emerged from the aircraft was a sight that none of the civilian medical staff had ever expected to witness. A full complement of Navy SEALs in combat gear, followed by an officer whose uniform bore the insignia of a Rear Admiral. Admiral Catherine Harrison stepped onto the hospital helipad with the kind of commanding presence that radiated authority even from a distance. Her silver hair was pulled back in a regulation bun, and her dress blue uniform displayed an impressive array of ribbons and decorations that spoke to a distinguished career in naval special operations. Behind her, the SEAL team maintained a protective formation that suggested this was not a routine visit. Guard Captain Walsh, who had served in the Army before taking his civilian position, immediately recognized the gravity of the situation. He activated the hospital's emergency communication system and announced, "All medical personnel, we have high-ranking military officials requesting immediate access to the building. They are asking specifically to speak with Captain Martinez regarding an urgent operational matter." The announcement sent ripples of shock throughout the hospital. Jennifer Kyle, who had been attempting to process her own inadequacy during the morning's crisis, stared at the military aircraft with growing comprehension. "Captain Martinez," she repeated slowly. "Not Nurse Weston, Captain Martinez." Dr. Chen, who had witnessed Adrienne's extraordinary medical intervention firsthand, felt pieces of a puzzle clicking into place with devastating clarity. The surgical precision, the knowledge of chemical weapons effects, the calm competence under extreme pressure, it all made sense if Adrienne Weston was actually a military medical officer with combat experience. Admiral Harrison and her escort entered the hospital through the emergency department doors, their presence immediately commanding the attention of every person in the vicinity. The Admiral's eyes swept the assembled staff with the kind of systematic assessment that comes from years of evaluating personnel and situations under pressure. "I need to speak with Captain Adrienne Martinez immediately," Admiral Harrison announced, her voice carrying the authority of someone accustomed to having her orders followed without question. "This is a matter of urgent national security that requires her immediate attention." The silence that followed her announcement was deafening. Patricia Hawthorne stepped forward, her face reflecting the confusion and growing realization that was spreading through the gathered staff. "Admiral, I believe you're looking for someone we know as Adrienne Weston. She's one of our nurses." Admiral Harrison's expression shifted slightly, revealing a flash of something that might have been sympathy or understanding. "Captain Martinez has been operating under an assumed identity for personal security reasons," she explained. "But current circumstances require her immediate return to active duty status." Dr. Torres felt her world shift as the implications became clear. The quiet, supposedly incompetent nurse who had been subjected to months of workplace harassment was actually a Navy captain with security clearance high enough to warrant a personal visit from an admiral. The magnitude of the mistake they had all made was staggering. "Where is Captain Martinez now?" Admiral Harrison continued, her tone indicating that delay was not acceptable. "We have a critical situation developing that requires her specific expertise and leadership capabilities." Marcus Thompson, who had been quietly observing from the back of the crowd, raised his hand tentatively. "She was working in the supply closet on the 3rd floor, he offered. "But after what happened this morning in trauma, I'm not sure." Admiral Harrison's attention focused on him with laser intensity. "What happened in trauma?" Dr. Chen stepped forward, still processing the revelation that was reframing everything she thought she understood about her colleague. "There was an industrial accident, multiple casualties with chemical exposure and blast injuries. Adrienne, Captain Martinez, she performed emergency surgery and toxicology intervention that saved a man's life. Her expertise was extraordinary." A slight smile crossed Admiral Harrison's features. "That sounds like Phoenix," she said quietly, using what was clearly a call sign rather than a name. She always had an instinct for being exactly where she was needed most. Phoenix. The call sign hit the assembled staff like another revelation. Military personnel didn't earn nicknames like Phoenix without demonstrating exceptional capabilities under the most extreme circumstances. The quiet woman they had dismissed as weak and incompetent had a reputation within the military community that commanded respect at the highest levels. "Admiral," Dr. Torres began hesitantly, "we had no idea about Captain Martinez's background. Her personnel file shows only basic nursing credentials. We've been treating her as an entry-level employee." Admiral Harrison's expression hardened slightly. Captain Martinez requested complete anonymity when she transitioned to civilian life. Her service record is classified at the highest levels, but current circumstances require her immediate return to operational status. The elevator doors opened at the far end of the emergency department, and Adrienne Weston stepped out, pushing her supply cart with the same careful, deliberate movements that had characterized her behavior for months. She was focused on her inventory clipboard and didn't immediately notice the crowd gathered near the entrance. When she finally looked up and saw Admiral Harrison standing in the center of the emergency department, surrounded by SEALs and hospital staff, the transformation was instantaneous and complete. Her shoulders straightened, her posture shifted from defensive to alert, and the careful mask of incompetence fell away entirely. For the first time since arriving at Mercy General Hospital, Adrienne Martinez stood at her full height and met the gaze of everyone watching her. The quiet, apologetic nurse was gone, replaced by a woman whose bearing radiated the kind of confidence and authority that comes from commanding respect in the most dangerous situations on Earth. "Admiral Harrison," she said, her voice carrying none of the soft uncertainty that had defined her interactions for months. "I assume this isn't a social call." The hospital staff stared in shock as they witnessed the complete transformation of someone they thought they knew. This was Captain Adrienne Martinez, a woman whose true identity was about to reshape everything they understood about courage, competence, and the deadly mistake of judging people by their desire to remain invisible. Admiral Harrison's eyes never left Adrienne's face as she spoke, her voice carrying the weight of classified operations and national security imperatives that civilian personnel could never fully comprehend. Captain Martinez, we have a situation developing off the coast of Somalia. The USS Leviathan has encountered an unprecedented crisis during a classified humanitarian mission. The assembled hospital staff watched in fascination and growing comprehension as Adrienne's transformation completed itself. Gone entirely was the hunched, apologetic posture they had known for months. In its place stood a naval officer whose bearing radiated the kind of quiet competence that comes from leading people through impossible situations. "What's the nature of the crisis, Admiral?" Adrienne asked, her voice now carrying the crisp, professional tone of someone accustomed to receiving and processing critical intelligence under pressure. Admiral Harrison glanced meaningfully at the crowd of civilian personnel surrounding them. "The details are classified, Captain, but I can tell you that we have multiple casualties involving exotic toxin exposure and combat trauma. The ship's medical officer was among the first casualties, and the remaining medical personnel are overwhelmed by conditions they've never encountered." Dr. Torres felt her understanding of the situation crystallize with shocking clarity. The Navy wasn't just asking for medical assistance. They were requesting the services of someone with specialized expertise in both combat medicine and chemical weapons effects. The industrial accident that morning had been a preview of capabilities that were apparently well known within military circles. "How many casualties are we discussing?" Adrienne continued, her questions revealing a depth of operational thinking that had been completely hidden during her months at Mercy General. 43 crew members affected by exposure, with 17 in critical condition, requiring immediate specialized intervention, Admiral Harrison replied. "Captain, you're the only medical officer with both the combat experience and the toxicology expertise needed to handle this situation. Your knowledge of unconventional weapons effects and field surgery makes you irreplaceable." Patricia Hawthorne, who had spent months systematically undermining Adrienne's confidence, found herself staring at a woman whose military credentials were apparently so impressive that admirals personally traveled to civilian hospitals to request her services. The cognitive dissonance was overwhelming. "Captain Martinez," Dr. Chen interrupted hesitantly, "I don't understand. Your personnel file here shows only basic nursing credentials. How do you have expertise in toxicology and combat medicine?" Adrienne turned to face her former colleagues, and for the first time since the revelation began, her expression softened slightly with something that might have been sympathy for their confusion. "My medical training didn't come from civilian nursing programs," she explained quietly. "I was trained as a Navy SEAL combat medic with additional specialization in chemical and biological weapons countermeasures." The words hit the hospital staff like physical blows. Navy SEAL, the most elite military unit in the world, where fewer than 25% of candidates survived the notorious training program. Jennifer Kyle actually took a step backward, her face pale with the realization of how drastically she had misjudged the woman she had spent months mocking. Admiral Harrison continued the revelation that was systematically destroying every assumption the hospital staff had made about their quiet colleague. Captain Martinez served 3 tours in Afghanistan and 2 in Iraq, where she led medical teams supporting the most dangerous special operations missions. She has 17 confirmed saves under direct enemy fire and has been decorated for valor on 5 separate occasions. Dr. Pemberton, whose condescending attitude had been particularly harsh toward Adrienne, found his voice reduced to a whisper. 17 saves under enemy fire? That means Captain Martinez performed complex medical procedures while being shot at, Admiral Harrison confirmed. She's saved lives under conditions that would have paralyzed most medical professionals. Her expertise in treating unconventional weapons effects comes from real-world experience with chemical attacks in combat zones. The industrial accident that morning suddenly made perfect sense. The calm competence, the immediate recognition of organophosphate poisoning, the surgical precision under pressure, all of it reflected training and experience that far exceeded anything taught in civilian medical schools. Marcus Thompson, who had witnessed some of Adrienne's unconscious defensive reactions, raised his hand tentatively. Captain Martinez, is that why you sometimes seemed hyper-vigilant, like you were always watching for threats? Adrienne nodded slowly. Combat deployment changes how you process your environment, she explained. You learn to assess threats automatically, to maintain situational awareness even during routine activities. It's a survival mechanism that's difficult to turn off. The revelation explained so many of the small mysteries that had accumulated over months. Her perfect spatial awareness during medical emergencies, her instinctive understanding of triage protocols, her ability to remain calm under extreme pressure, all of it reflected training and experience that had been invisible to civilian eyes. But why hide it? Dr. Torres asked, her voice reflecting genuine bewilderment. Why take a position as an entry-level nurse when you clearly have qualifications that would make you valuable to any hospital? For the first time since Admiral Harrison's arrival, Adrienne's composure wavered slightly. The question touched something deeper than professional credentials. It reached into the psychological wounds that had driven her to seek anonymity in the first place. Because sometimes surviving combat means learning to live with things that civilians can't understand, she replied quietly. I lost my entire medical team during my final deployment. Operation Crimson Dawn in Afghanistan. We were providing medical support for a hostage rescue mission when everything went wrong. The silence in the emergency department became absolute. Admiral Harrison's expression grew solemn as Adrienne continued her explanation, revealing the trauma that had driven one of the Navy's most decorated combat medics into hiding. The intelligence was faulty. We walked into an ambush instead of a rescue operation. Chemical weapons were deployed against our position, and I was the only member of my medical team to survive. 12 people under my command died because I made the decision to proceed with the mission, despite warning signs I should have recognized. Patricia Hawthorne felt tears welling in her eyes as she began to understand the weight that Adrienne had been carrying. The quiet, withdrawn behavior that had been interpreted as incompetence was actually the manifestation of survivors' guilt and post-traumatic stress from losing an entire team of people she had been responsible for protecting. Captain Martinez, Admiral Harrison said gently, the investigation into Operation Crimson Dawn concluded that you made the correct tactical decisions based on available intelligence. The ambush was the result of intelligence failures at levels far above your command authority. Your actions during the chemical attack saved the lives of 47 civilians who were being held at the target location. Dr. Chen stared at the woman she had worked alongside for months, finally understanding the true scope of what she had witnessed that morning. The way you handled the organophosphate poisoning, you'd seen it before, in combat. Adrienne nodded. Chemical weapons were used extensively in that region. I developed protocols for treating exposure based on field experience with multiple casualty events. What you saw this morning was application of techniques I learned while trying to save my team. The revelation recontextualized everything the hospital staff thought they understood about competence, trauma, and the invisible wounds carried by veterans who had transitioned to civilian life. The woman they had dismissed as weak had been carrying the psychological weight of command decisions made under the most extreme circumstances imaginable. Captain Admiral Harrison continued, "The current situation aboard the USS Leviathan involves chemical weapons effects similar to what you encountered during Crimson Dawn. Your experience with both the medical protocols and the psychological aspects of mass casualty chemical exposure makes you uniquely qualified to handle this crisis." Adrienne straightened, her military bearing returning as she processed the operational requirements. "What's my timeline for departure, Admiral?" "We need to be airborne in 15 minutes. The situation is deteriorating rapidly, and every minute of delay increases the casualty count." The transformation was complete. Captain Adrienne Martinez, decorated Navy SEAL combat medic, was accepting a mission that would once again place her in the position of making life-and-death decisions under extreme pressure. The quiet nurse who had sought anonymity at Mercy General Hospital was preparing to return to the world where her expertise could mean the difference between salvation and catastrophe. The hospital staff watched in awe as their understanding of human courage and hidden strength was fundamentally redefined by a woman they had never really known at all. The seconds following Admiral Harrison's mission briefing hung in the air like the aftermath of an explosion, leaving the hospital staff to grapple with the devastating realization of how completely they had misunderstood the woman standing before them. The cognitive dissonance was so profound that several people seemed physically unable to process what they were witnessing. Patricia Hawthorne was the first to break. The woman who had systematically tormented Adrienne for months suddenly found herself confronting the magnitude of her cruelty toward someone whose service record represented the highest levels of military honor and sacrifice. Her hands began to shake as the full weight of her behavior crashed down upon her. "Captain Martinez," Patricia whispered, her voice cracking with emotion she couldn't contain. I called you dead weight. I questioned your competence. I made your life miserable for 6 months." Tears began streaming down her face as she struggled to continue. "You're a decorated war hero, and I treated you like you were worthless." The breakdown was so complete, so genuine in its horror and self-recrimination, that it sent shockwaves through the assembled crowd. Patricia Hawthorne had been the architect of the hostile work environment that had defined Adrienne's experience at Mercy General, and watching her confront the reality of what she had done created a moment of profound moral reckoning for everyone present. Dr. Pemberton, whose condescending attitude had been particularly harsh, found himself unable to meet Adrienne's eyes. "Jesus Christ," he muttered, running his hands through his hair in a gesture of complete bewilderment. "I questioned your medical license. I suggested you weren't qualified to be a nurse. You're more qualified than any of us." Jennifer Kyle, who had been the most vocal in her mockery and dismissal, stood frozen in a state of shock that seemed to have paralyzed her capacity for speech. The woman she had called weak, timid, and incompetent had earned respect in situations where Jennifer's courage would have evaporated within minutes. The contrast between her own petty workplace cruelty and Adrienne's service under combat conditions was so stark that it left her questioning everything she thought she understood about strength and character. Dr. Torres stepped forward, her medical training helping her process the situation with slightly more composure than her colleagues. "Captain Martinez, we owe you an apology that goes beyond anything words can express. We failed to see who you really were, and worse, we created an environment where your expertise was wasted and your service was dishonored." Admiral Harrison watched the emotional breakdown of the civilian staff with the kind of professional detachment that comes from years of witnessing the psychological impact of military revelations on unprepared civilians. Captain Martinez's decision to maintain operational security about her background was her choice, she said firmly. She had every right to seek anonymity after her service. But the explanation did nothing to alleviate the growing sense of moral horror that was spreading through the hospital staff. Marcus Thompson, who had always seemed to sense something different about Adrienne, spoke up with a voice filled with regret. All those times you flinched when people approached you from behind, all those moments when you seemed hyper-vigilant, you were dealing with combat trauma while we were treating you like you couldn't handle basic nursing duties. The observation opened another dimension of understanding about the psychological burden Adrienne had been carrying. Post-traumatic stress from losing her medical team, survivor's guilt from making command decisions that resulted in casualties, and the daily humiliation of being treated as incompetent by people whose understanding of pressure and responsibility was purely theoretical. Dr. Chen, who had witnessed both Adrienne's morning medical intervention and her current military bearing, shook her head in amazement. The way you handled the chemical poisoning this morning, you weren't lucky or instinctive. You were applying field-tested protocols developed under combat conditions. We were watching military medicine being practiced in a civilian setting. Adrienne, who had been silently observing the emotional breakdown of her former colleagues, finally spoke. Her voice carried none of the anger or resentment that would have been justified after months of systematic mistreatment. Instead, it reflected the kind of composed understanding that comes from having faced far greater challenges than workplace harassment. "I don't need apologies," she said quietly, her tone carrying the authority of someone accustomed to managing people under extreme stress. What happened here was the result of assumptions and incomplete information. In combat situations, we call that fog of war. The important thing is learning from the experience and applying that knowledge going forward. The grace with which she handled their collective guilt was almost as shocking as the revelation of her military background. Patricia Hawthorne, still struggling with the magnitude of her misjudgment, looked up through her tears with an expression of desperate seeking for redemption. "Captain, how do we make this right? How do we honor what you've done and make up for how we treated you?" Adrienne considered the question for a moment, her gaze moving across the faces of the people who had made her life difficult for months. When she spoke, her words reflected the kind of leadership wisdom that could only come from commanding people in life-and-death situations. "You make it right by changing how you treat the next person whose background you don't fully understand," she replied. "Every person in this hospital is carrying stories and experiences that aren't visible on their personnel files. Judge people by their character and their actions, not by your assumptions about their limitations." Admiral Harrison, who had been monitoring the emotional processing with professional patience, stepped forward to redirect attention to the operational urgency of the situation. "Captain Martinez, we need to discuss mission parameters during flight. The situation aboard the USS Leviathan is deteriorating rapidly." The reminder of immediate military necessity created a sharp transition from the emotional revelations of the past few minutes. Adrienne straightened into full military bearing, her transformation from civilian nurse to Navy captain completing itself with practiced efficiency. "Understood, Admiral. I'll need 5 minutes to gather personal equipment and brief my replacement on current patient status." Dr. Torres stepped forward with an expression of professional respect that had been completely absent from her previous interactions with Adrienne. "Captain Martinez, whatever equipment or resources you need from this hospital are yours. If there's anything we can do to support your mission—" "Actually, there is something," Adrienne replied, her tactical thinking already shifting to operational requirements. Dr. Chen, your performance during the industrial accident this morning was exceptional under pressure. If the Navy were to request civilian medical consultation for this mission, would you be willing to assist? The offer was both an honor and a form of redemption, an opportunity for Dr. Chen to contribute to a mission led by the woman whose capabilities she had finally begun to understand. Absolutely, Captain. It would be an honor to support whatever operation you're leading. Jennifer Kyle, still struggling with her own psychological processing, found her voice for the first time since the revelation began. Captain Martinez, she said hesitantly, I know I have no right to ask this, but could you teach us? When you return from this mission, could you help us understand real emergency medicine? Could you help us be better at what we do? The request represented a complete reversal from months of antagonism to a desperate desire for learning and improvement. Adrienne studied Jennifer's face for a moment, assessing the sincerity of the request with the same analytical skills she used to evaluate personnel under her command. If the Navy allows me to return to civilian consulting, I'd be willing to develop training programs that incorporate combat medical techniques into civilian emergency protocols, she replied. There are lessons learned from military medicine that could save lives in civilian settings. Admiral Harrison checked her watch with the kind of time consciousness that indicated operational deadlines were non-negotiable. Captain Martinez, we need to depart immediately. The USS Leviathan cannot wait for extended transition procedures. Adrienne nodded and turned to address her former colleagues one final time as Captain Martinez rather than Nurse Weston. Take care of the chemical plant victims. Apply the protocols you observed this morning and don't hesitate to consult military medical resources if you encounter similar exposures. As she walked toward the exit with Admiral Harrison and the SEAL escort, the hospital staff watched with a mixture of awe, respect, and profound regret. The quiet woman they had dismissed was leaving to command a military medical crisis that would test every skill she had developed during her decorated career. The transformation was complete, and Mercy General Hospital would never be the same. 3 weeks later, Captain Adrienne Martinez returned to Mercy General Hospital not as the hidden, diminished nurse who had pushed supply carts through sterile corridors, but as a woman whose recent mission had earned her a Navy Cross and international recognition for preventing what military analysts described as a potential humanitarian catastrophe of unprecedented scale. The mission aboard the USS Leviathan had required her to coordinate medical response to a chemical weapons attack that had affected not only the ship's crew, but also 200 civilian refugees they had been evacuating from a conflict zone. Her expertise in mass casualty chemical exposure, combined with her leadership under extreme pressure, had saved 178 lives and prevented the contamination from spreading to nearby civilian populations. News of her heroism had reached Mercy General through military channels and media coverage that finally revealed the true identity of the woman they had known as Adrienne Weston. Hospital Administrator Robert Sterling, who had been completely unaware of his institution's treatment of a decorated war hero, had personally requested her return to discuss new opportunities that would honor her service while utilizing her extraordinary capabilities. The hospital's main conference room had been converted into a formal presentation space where Captain Martinez would address the entire medical staff. Unlike the chaotic emergency department, where her identity had been revealed 3 weeks earlier, this setting allowed for structured processing of the fundamental changes that her revelation had initiated throughout the institution. Dr. Rebecca Torres, who had been appointed to lead the hospital's new Veterans Integration Initiative, stood at the podium as staff members filed into the room. The atmosphere was dramatically different, from any previous all-hands meeting in the hospital's history. There was a palpable sense of anticipation mixed with institutional humility as medical professionals who had once dismissed one of their colleagues prepared to hear from a woman whose expertise far exceeded their own. Before Captain Martinez addresses us, Dr. Torres began, her voice carrying a gravity that reflected the magnitude of recent revelations. I want to acknowledge that this institution failed in our fundamental responsibility to recognize and support a service member transitioning to civilian life. What happened here represents a systemic failure that we are committed to never repeating. When Captain Martinez entered the conference room, she wore civilian clothes rather than military uniform, but her bearing reflected the confidence and authority that had been hidden for months beneath a facade of institutional submission. The transformation was complete and permanent. There would be no return to the diminished persona that had characterized her previous tenure at Mercy General. Patricia Hawthorne, who had undergone intensive counseling to process her role in creating a hostile work environment, stood as Captain Martinez passed her table. The gesture was both formal recognition and personal atonement for months of systematic mistreatment that now appeared not just cruel, but grotesquely inappropriate given the scope of Martinez's service record. "Captain Martinez," Patricia said quietly, her voice carrying the weight of genuine remorse and hard-won understanding, "I want you to know that your experience here has fundamentally changed how this hospital approaches staff integration and support services for veterans transitioning to civilian healthcare careers." The institutional response to the revelation had been swift and comprehensive. Mercy General had implemented new protocols for identifying and supporting veterans in their workforce, created mentorship programs that recognized the unique challenges of military to civilian career transitions, and established training initiatives that incorporated combat medical techniques into their emergency response procedures. Captain Martinez took the podium with the same calm presence that had defined her performance during medical emergencies, but now her authority was openly acknowledged rather than hidden beneath assumptions of incompetence. When she spoke, her voice carried the kind of measured confidence that comes from having proven oneself in the most extreme circumstances imaginable. "I want to begin by acknowledging the extraordinary work that this medical team performed during the North Shore chemical plant emergency," she said, her opening words immediately establishing a tone of professional respect rather than recrimination. "The protocols you implemented and the lives you saved demonstrate exactly the kind of excellence that military medical training is designed to support, not replace." Dr. Chen, who had been selected to collaborate with Captain Martinez on developing new emergency response procedures, felt a surge of professional pride mixed with continued amazement at the grace with which Martinez handled her institutional vindication. The integration of military and civilian medical expertise represents an opportunity to enhance emergency response capabilities while honoring the service of veterans who choose to continue their healing mission in civilian settings. Captain Martinez continued, "My proposal is to establish a comprehensive program that benefits both veteran healthcare workers and the institutions that employ them." Jennifer Kyle, who had undergone her own process of psychological reckoning with her previous behavior, raised her hand to ask the question that many staff members had been struggling with since the revelation of Martinez's true identity. "Captain Martinez, how do we ensure that we never again fail to recognize the expertise and experience that veterans bring to our hospital? How do we create an environment where someone with your background feels valued rather than diminished?" The question reflected institutional learning that went far beyond simple policy changes. It touched on fundamental issues of respect, recognition, and the complex challenges of integrating military experience into civilian work environments. The answer lies in understanding that military service members develop capabilities under pressure that often exceed what traditional training programs can provide, Captain Martinez replied. But those capabilities are only valuable in environments that recognize and utilize them appropriately. Administrator Sterling, who had been quietly observing the interaction, stepped forward to address the broader implications of the hospital's experience with Captain Martinez. "We have established the Martinez Institute for Combat Medical Integration," he announced, "which will serve as a national model for incorporating military medical expertise into civilian healthcare systems." The announcement represented institutional transformation on a scale that went far beyond addressing past mistakes. Mercy General Hospital was positioning itself as a leader in veteran integration, using Captain Martinez's experience as the foundation for programs that would benefit both military service members and civilian patients nationwide. Marcus Thompson, who had always sensed something exceptional about Captain Martinez, despite the institutional failure to recognize her capabilities, stood to address the broader lessons learned from the experience. "This situation taught all of us that our assumptions about people's backgrounds and capabilities can blind us to extraordinary talent and experience," he said. "We need to approach every new employee with the humility to recognize that we might not understand the full scope of what they bring to our institution." The institutional changes extended beyond Mercy General Hospital. Captain Martinez's story had been featured in military and civilian publications as an example of both the challenges facing veterans transitioning to civilian careers and the extraordinary contributions they could make when properly recognized and supported. Dr. Pemberton, whose condescending attitude had been particularly harsh during Captain Martinez's tenure as Nurse Weston, approached the podium with an expression that reflected profound personal change. "Captain Martinez, I want to publicly acknowledge that my behavior toward you was inexcusable," he said, his voice carrying genuine contrition. "Your grace in handling our collective failure has taught me lessons about leadership and character that no medical textbook could provide." The institutional transformation culminated in Captain Martinez's acceptance of a new position as Director of Emergency Medical Innovation, a role that would allow her to develop training programs incorporating combat medical techniques while maintaining connection to active military medical operations through consulting relationships with the Navy. "I'm not returning to seek vindication or recognition," Captain Martinez concluded her presentation. "I'm returning because this institution has demonstrated a genuine commitment to change, and because the integration of military and civilian medical expertise can save lives in ways that neither approach can achieve independently." As the meeting concluded, the staff of Mercy General Hospital understood that they had witnessed more than just personal redemption or institutional reform. They had participated in a fundamental redefinition of how medical institutions could recognize, support, and utilize the extraordinary capabilities of veterans who chose to continue their service in civilian settings. The quiet nurse who had been dismissed as incompetent had become the foundation for programs that would transform veteran integration throughout the healthcare industry, proving that recognition of hidden strength could create benefits that extended far beyond individual vindication. 6 months after Captain Adrienne Martinez had officially assumed her role as Director of Emergency Medical Innovation at Mercy General Hospital, the institution had become a beacon of excellence in veteran integration and combat medical techniques. The Martinez Institute for Combat Medical Integration had attracted attention from medical institutions nationwide, and Captain Martinez herself had been invited to testify before Congress about veteran employment challenges in healthcare settings. On a crisp autumn morning, as golden leaves drifted past the windows of the emergency department, Captain Martinez was conducting her weekly rounds when she noticed something that would have been invisible to most observers, but rang alarm bells for someone trained in recognizing hidden distress signals. A new orderly named David Chen, no relation to Dr. Chen, was moving through the corridors with the kind of hyper-vigilant awareness that Captain Martinez recognized immediately. His eyes constantly scanned exits and potential threat positions. His posture remained rigid despite attempts at civilian casualness, and his hands showed the calluses consistent with weapons training. Most tellingly, he flinched almost imperceptibly whenever anyone approached from his peripheral vision. David had been hired 3 weeks earlier through the hospital's new veteran preference hiring program, but his personnel file listed only basic orderly training and no military experience. Captain Martinez had learned to recognize the signs of someone working very hard to hide a military background, and every instinct developed during her years of command told her that David Chen was carrying secrets that were eating him alive. She observed him for several days before taking action, noting the pattern of behaviors that spoke to combat experience and probable post-traumatic stress. During night shifts, when he thought no one was watching, his military bearing became more pronounced. He organized supply closets with the kind of systematic efficiency that suggested logistics training, and his knowledge of basic medical procedures seemed to exceed what his stated background would support. The breakthrough came when Captain Martinez witnessed David's response to a medical emergency involving a construction worker who had been brought in after an accident involving industrial chemicals. As the emergency team struggled with decontamination procedures, David stepped forward with advice that revealed intimate knowledge of chemical exposure protocols. "The neutralizing agent concentrations are wrong," he said quietly to the attending physician. "At those levels, you're going to cause secondary burns. You need to dilute the solution by half and increase the rinse duration." Dr. Torres, who was leading the treatment, paused to consider his suggestion. The protocols David was describing weren't taught in basic medical training. They were specialized knowledge that came from military or industrial safety experience. Following his advice resulted in successful treatment that prevented the kind of secondary injuries that had initially seemed inevitable. After the emergency had been resolved, Captain Martinez approached David in the supply closet, where he was restocking inventory with the kind of meticulous organization that screamed military training. "David," she said quietly, using the same calm, non-threatening tone she had once used to approach traumatized soldiers. "That was excellent work with the chemical exposure protocols. Where did you learn about neutralizing agent concentrations?" David's response was immediate and telling. His shoulders tensed, his eyes darted toward the exits, and his hands moved to positions that suggested defensive training. The reaction lasted only seconds before he caught himself and attempted to return to the submissive civilian persona he had been maintaining. I read about it online," he offered weakly, his voice carrying the same kind of deflection that Captain Martinez had once used to hide her own background. "I'm interested in emergency medicine." Captain Martinez recognized every element of his performance because she had perfected the same act of concealment during her months as Nurse Weston. The careful incompetence, the apologetic demeanor, the determined invisibility, all of it designed to hide capabilities that he was afraid to acknowledge. "David, I know what it looks like when someone with military training tries to blend into a civilian workplace," she said gently. "I also know what it feels like to carry guilt about things that happened during deployment." The words hit their target with devastating accuracy. David's careful facade cracked and for a moment the competent, haunted soldier beneath the orderly's uniform became visible, his eyes filled with the kind of pain that comes from carrying secrets too heavy for one person to bear, alone. I'm not supposed to talk about it," he whispered, his voice carrying the weight of classified operations and survivors' guilt. "What happened over there? The people who didn't make it home? It's my fault." Captain Martinez felt the familiar ache of recognition. She was looking at a younger version of herself, someone whose service had ended in tragedy and whose transition to civilian life had become an exercise in hiding from a past that demanded acknowledgement. "David, what's your real name?" she asked quietly. He hesitated for a long moment before answering. "Staff Sergeant David Martinez, Army Rangers, 3 tours in Afghanistan, explosive ordnance disposal specialist." The revelation explained everything: the chemical knowledge, the hypervigilance, the careful competence hidden beneath assumed incompetence. EOD specialists dealt with the most dangerous weapons on the battlefield, often working alone under conditions that would terrify most people. The psychological pressure of that responsibility, combined with survivors' guilt from losing team members, created exactly the kind of trauma that drove veterans to seek anonymity in civilian jobs. "Staff Sergeant Martinez," Captain Martinez said, using his military rank to establish credibility and respect. "I'm Captain Adrienne Martinez, Navy SEALs. I spent months in this hospital hiding my background because I lost my entire medical team during my final deployment. I understand exactly what you're carrying." The use of proper military address and the revelation of shared experience broke through David's defensive barriers completely. For the first time since his arrival at Mercy General, he stood at his full height and met her gaze with the kind of direct eye contact that spoke to military bearing and mutual respect between service members. "Captain, I lost 4 men during my last deployment," he said, his voice steady despite the pain it carried. "IED went off while I was trying to disarm it. Should have been me who died, not them. I can't face being responsible for anyone else's life." Captain Martinez understood the survivor's guilt that was driving his need for invisibility. She had carried the same burden, the same conviction that her survival had somehow come at the cost of better people's lives. "Staff Sergeant, the fact that you survived doesn't make you responsible for their deaths," she said, with the authority of someone who had learned these lessons through her own painful journey toward acceptance. "It makes you responsible for living in a way that honors their sacrifice." Over the following weeks, Captain Martinez worked with David to process his trauma, while gradually integrating him into more advanced medical responsibilities that utilized his military training. His knowledge of explosive injuries and chemical hazards proved invaluable to the emergency department, and his leadership capabilities, once hidden beneath assumed incompetence, made him a natural mentor for other veterans transitioning to civilian healthcare careers. The Martinez Institute expanded its mission to include systematic identification and support of veterans who were hiding their military backgrounds due to trauma or transition difficulties. Captain Martinez developed protocols for recognizing the signs of concealed military experience and created support systems that honored service while addressing the complex psychological challenges of civilian reintegration. 6 months later, Staff Sergeant David Martinez had accepted a position as the hospital's first Veteran Liaison Coordinator, helping to identify and support other service members who were struggling with civilian transition. His story became part of the training materials used to educate civilian staff about the hidden challenges facing veteran employees. As Captain Martinez stood on the hospital's rooftop observation deck, Watching the sunset paint the sky in brilliant oranges and purples, she reflected on the transformation that had begun with her own forced revelation months earlier. The quiet nurse who had sought invisibility had become the foundation for programs that were changing how healthcare institutions across the country recognized and supported veteran employees. A young nurse approached her, tablet in hand with the day's reports on veteran integration initiatives. Captain Martinez, we have 3 new veteran hires starting next week, and 2 current employees have self-identified as having military backgrounds they've been hiding. Captain Martinez smiled, understanding that each revelation represented not just individual healing, but institutional progress toward recognizing the hidden strength that existed within their workforce. Schedule individual meetings with each of them, she instructed. Make sure they understand that their military experience is valued here, not something to hide. As night fell over Mercy General Hospital, Captain Martinez knew that the cycle of recognition and support would continue. The institution that had once failed to see the hero hiding in plain sight had become a place where no veteran would ever again need to diminish themselves to find acceptance. The quiet revolution she had started was spreading, one hidden warrior at a time. If you believe that those who appear weakest sometimes carry the greatest strength, type "I see heroes" in the comments. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.